Welcome to the Preparing for a Career in the Health Professions Zoom webinar. My name is Charlie Scruggs. I'm the director of the Health Professions Advising Center here at UCR. And I'm also going to be joined with our assistant director, Amber Nicholson, who's going to help field and answer questions at the end of the presentation. So again, thank you for joining us. A little bit about the Health Professions Advising Center at UCR. We are a resource to provide information, support, resources, and advising for students who are interested in pursuing a career in graduate and professional health programs. So we work with students to identify courses, to talk about extracurricular preparation, whether that be volunteering, shadowing, research opportunities, service, whether it be on campus or in the community, whether it be throughout the country or even globally. Our population is very wide. We work with students who are interested in any health profession at any level or degree. So we have students that come in that are pursuing a degree that may be interested in a health professions program very early on. It may be toward as they're getting ready to graduate. There are over 120 different health professions, so students are coming in asking about some of the basic health professions that you probably know about, medicine, dentistry, pharmacy, all the way to more complex health professions programs. Any UCR student can use our resources, any student in any major. We also work with our alumni to explore health professions. And again, that could be students that have just graduated who have been working with our office throughout their tenure at UCR, or they just found out about our office right when they graduated, or they've been out working and they've decided to have a career change and now they're interested in pursuing a career in the health professions. There's no application fee or no application or fee to utilize HPAC services. So we are a completely free resource. It's built into students' tuition. So we want them to come in and see us, but we don't require, again, an application or a fee for our services to current students or alumni. Students that do utilize our office, they don't receive a minor or certificate for being pre-health. Those courses are typically built into their degree. And if they're not, let's say that they're a non-science major, we'll talk a little bit about how that works. But we don't offer a pre-med minor certificate or major at UCR. We often get questions about that, but it would just be completing the coursework for the health professions program. We are open all year round. So most of our students come to school in the fall, in late September, and are with us until the end of spring quarter, which is mid-June. So we operate fall, winter, spring, and even in the summer quarter. And our services are all available. Our advising services are available during that time, as well as a variety of workshops that we do. HPAC is staffed by 2 full-time employees, myself and my assistant director. We also have student worker staff. We have peer mentors, and we'll talk a little bit about them as well. And we support roughly 5,000 students annually. If you want to organize HPAC services in terms of maybe pillars, I would say that our 3 strengths would be advising, mentoring, and workshops. So our advising is done by myself and my assistant director. We also have a graduate student who is working in our office, and we see students in 30 or 60-minute increments. Students' first appointment is typically for an hour. Follow-up appointments can be 30 minutes to 60 minutes. We really let the student decide that. We also have 14 ambassadors who do peer mentoring, and they are juniors and seniors, upper level students that have interest in the health professions. So they volunteer for our office, working with students who drop in. They see a lot of our first year students that have questions about how to get involved in shadowing and volunteering and campus organizations and that type of thing. And then they also work with us to do various activities like Highlander Day. So if we were to have been on campus this year, you would have been meeting many of our ambassadors who would be sharing their experience as a pre-health student on campus. But we are utilizing them this quarter through various webinars, Zoom meetings, and that type of thing. Each year we put on roughly, last year I think it was around 95 workshops and events and career panels. We do a lot of those on our own, and we do a lot of them with other offices on campus, such as the Career Center, our Science College, our College of Natural and Agricultural Sciences, our Humanities and Social Science College. So we try to do programming in a variety of different ways. Specifically to us, we offer a plethora of workshops. I'll talk a little bit about those when we go through our sample schedule of what we would offer each quarter. But additionally, after the call, if you want to take a look at our website, you'll see our portfolio of workshops that are available for students. We offer a wide variety all year long. We have learning outcomes. So for students that are attending, let's say, an introductory to health professions workshop, or what is a post-bac program, or what is an application workshop, or our personal statement workshop. Each of those workshops have definitions, learning outcomes, and so students have an idea of when they should be participating in those and what hopefully they should be getting out of those. So that's all available on our website. One of the key things that we do in our office is we also do mock interviews for students that have upcoming interviews to any of the health professions programs. So we find that they're often very nervous, they're wanting some support, and we provide that to them as well, again, free of charge. We have a student resource library and resource room in our department, in our office, which is located in Rivera Library. So students typically come in, they are welcome to study. We have a variety of test prep books they can check out, other resources about being pre-health. This is also where our ambassadors hang out through the day for drop-in questions. It's where we do advising, and that's located in Rivera Library. So we are not there now due to COVID-19, but generally speaking, we're there Monday through Friday, 8 to noon and 1 to 5. We have a very active email listserv. We send out a weekly update every Monday morning to our current students and alumni regarding workshops that are going on, other events. Sometimes we have health providers looking for students to scribe for them, or maybe they're looking for volunteers in their office or clinic. Test prep companies such as the MCAT for medical school, DAT for dental school, PCAT for pharmacy school, they offer different products to test prep. So they will send us emails to market that. We also hear from health professions programs, which our students are very interested in hearing from. So medical schools, dental schools, pharmacy schools are often doing open houses or virtual open houses. And so we send that out to students as well. So once a student has been accepted to UCR and comes to UCR in the fall, they can sign up for that newsletter with their UCR email address. And they get those updates until they decide that they don't want to any longer. And then our website and social media, you will hear us reference that quite often. We put a lot of information out to our students via Facebook and Instagram and Twitter. We're currently working on a YouTube channel, but our website is also updated very frequently. So we make updates to that, I would say, every couple of weeks regarding things that are going on, workshops that we're offering, and that type of thing. So hpac.ucr.edu is always a great resource to check out. So I'm just showing you now what our typical workshop schedule looks like. So this was for fall. You'll see our Intro to Health Professions workshop is offered most frequently. We do ask that students attend that workshop before coming in and meeting with our advisor. So we offer it all four quarters, fall, winter, spring, and summer. But you'll see additionally like our interviewing workshop. I mentioned post-bac earlier, getting involved in extracurricular activities. We also work very collaboratively with our School of Medicine. So the workshops that you're seeing now are what we would offer typically in the fall. Our workshops are very cyclical based on where students are in the academic year or about to start or wrap up the application cycle. So again, all of these can be found on our website. And within that, we often mention what type of, for the workshop, what time of year that will be offered. I mentioned our ambassadors who do peer mentoring. So they are a really poignant piece of our office. We rely on them greatly. So we have 14 ambassadors for this academic year. Again, they rotate every year, typically juniors and seniors, and they've been a really great support for our office. Our ambassadors are also listed on our website along with their profile. So you can see as a student what they've been involved with at UCR and in the community. And we also have their email address posted there as well. We get a lot of questions, and rightfully so, about what's the right major, what's the best major, and the answer for that is there isn't one. We have students that come into college knowing that they are interested in the health professions and they will or want to pursue a science degree, your typical biology, chemistry, biochemistry. We also have students that come in that know what they want to do, and it might be in the health professions, but they really love English or psychology, or maybe they want to pursue a degree in engineering. And so we help them figure out, what courses that they need to take based on their health profession. Many students are interested in medicine, but again, there are over 120 different health professions. So we review the requirements of the specific health profession that they're interested in. We talk about what courses may already be aligned in their major, what courses they're going to have to plan to take, either while they're at UCR or maybe during the summer or maybe post-graduation. So this is when we really get into the in-depth part of the advising appointment and what that plan will look like for the student. We do talk with students about looking very early on at colleges and programs that they might be interested in. So if a student knew that they were interested in dentistry very early on, we're going to look at what dental schools collectively want regarding prereqs, what they may say regarding AP credit or IB credit, or even community college credit. So a student doesn't have to know what health profession they're interested in right when they start college, but if they do, that's helpful. The more information, the more experiences, the more conversations, the more research that a student has done into their career, we find that once they get into college, things tend, not always, but tend to be a little bit more understandable. They can make decisions based on evidence that they have, research that they have, and this can be a little bit easier to plan out. We also know that many students aren't sure. They figure this out while they're in college. That helps quite often. And sometimes we're able to get through that, and within 4 years, and there's not an issue. But again, the students that are a little more proactive in their planning, we find that this tends to be somewhat easier to navigate. We also talk a lot about GPA. GPA is really important. It's not everything, but schools in the health professions are looking at students across the board from freshman year, or maybe they took classes while they were in high school at a community college or a local college or university, all the way up to when they apply. So for the health professions, you have that cumulative GPA, the university GPA, but they're also going to be looking specifically at the science courses. So in our field, biology, chemistry, physics, math, or statistics is all considered science. In addition to the GPA, nearly all health professions programs require some type of professional standardized exam. This is typically, not always, but typically the student will take this exam at the end of their junior year before entering their senior year. If the student decides to take a gap year, then it could still be at the end of their third year, or maybe the end of their fourth year, their senior year. Most of our students know what the MCAT is, the medical college admissions test. The DAT is for dental school, the PCAT is for pharmacy school, the OAT is for optometry school, and many other programs such as nursing, veterinary medicine, physical therapy, occupational therapy, social work, those programs may require the GRE, which is the general record exam. As I shared, we work with students that are interested in many health professions. These are our very common health professions that students have shared with us. We know that students, by and large, are interested in going into medical school, either to an allopathic program, MD, or an osteopathic program, DO, followed by dentistry, pharmacy, physical therapy, occupational therapy, physician assisting, public health. We're also seeing students that are becoming more interested in the fields of podiatry and optometry. Another program that we get a lot of questions about is nursing. You probably know by now, or hopefully you know, that UCR does not offer a nursing program. If you've looked around on our website, you may see that we talk a little bit about nursing, or we have resources for students who are interested in nursing. And that's typically because we have students that come to UCR that are maybe interested in the health professions, or they're not sure what that is, or maybe they are absolutely set on medicine, and once they get into college, they decide maybe medical school is not right for them. And then we have students that weren't considering the health professions at all, and somewhere along their time at UCR, they've decided that they are interested in the field of nursing. So it really depends on where the student is. If the student is a first-year student and they're interested in nursing, we're going to have a long talk about, can UCR provide the courses that you need to get you on to the field of nursing in the time frame that you've set. If it's later down the road, then typically we're going to encourage that student to finish their degree, graduate, and then go off to take the prerequisites if they haven't, and get into a nursing program. If you are considering nursing, please know that UCR does not have a nursing program. We, to my knowledge, are not planning on having a nursing program anytime soon. So if nursing is something that you are considered pursuing, you really need to take a look at what nursing programs are out there, what they look like, whether they're at the 2-year level, the 4-year level, to see how those programs work, and then come back to UCR and look to see what we have. And if you're interested in nursing, then know that may be a better route, another school. But if you know that you are really wanting the UC degree or the UCR degree, know that to pursue nursing will likely take more than 4 years to complete. Where do our students go? This is a very common question. We send students all over the country after UCR to pursue their degree in the health professions field. If you go onto our website, we keep an updated list by health professions, and you can take a look at that. Over the past 5 years, we have had students go all over the country. Some of our students have even studied internationally, but by far, our students are here in the US, and we do encourage them to, just because of how the healthcare structure, laws work, and certification and licensure and that type of thing. So again, hpac.ucr.edu. On the front page, you can actually find this map and click on it, and we list where our alumni have went based on health professions. For those of you who are interested in pursuing medical school, I wanted to talk a little bit about a unique program that we have at UCR within our School of Medicine. We have something called the Thomas Hyder Scholar Program, and there's actually 2 parts of the program. The first component is the Hyder program itself, which each year it has 24 seats designated for students to enter our School of Medicine from UCR. So this program is exclusive to UCR. Each year, the School of Medicine has anywhere between 70 and 77 seats, and I know that's growing annually, but 24 seats have always been reserved for our students. So within those 24 seats, the students, it's somewhat of a smaller pool. We know that students that are interested in UCR and the UCR mission and do come to UCR to study as an undergraduate, you could sort of split this in different ways, but generally speaking, they have somewhat of a better chance of getting in if Again, they are, you know, really understanding the School of Medicine's mission and what they're looking for. Our School of Medicine is very Inland Empire centric. They're looking for those who want to serve in disadvantaged backgrounds, lower socioeconomic areas, places where there are not enough primary care physicians to serve the community. And so we do have a lot of students from the area and throughout the state that are interested in this program. To qualify, students have to complete at least 6 quarters at UCR and earn their bachelor's degree. So that is not a problem for students that are coming in from high school to college. It's typically not a problem if you're completing your entire degree at UCR. But the reason that we say six consecutive quarters is it also allows for transfer students to have the same opportunity. There's not anything specific that you have to do to apply to the Thomas Hyder program. That's actually done at the time that you apply to medical school, which is at the end of your junior year. So at the end of your junior year, you would start the American Medical College Application Service. We call that AMCAS, and you would apply or click that you're a Hyder applicant, as well as applying to other programs. There are roughly about 141 MD schools in the US. I mentioned osteopathic medicine as well. There are roughly 34 to 35 DO schools in the US as well. In addition to the Thomas Hyder program, there's the Thomas Hyder EAP Early Assurance Program. This program is a little more specific regarding those who have a commitment to UCR School of Medicine. It's the same timeline. It's the year before the junior year, before students would graduate and enter medical school. It just happens to be a little bit earlier in that junior year. And so instead of applying in the summer, which is when students typically apply to medical school and other health professions programs, students for the Hyder program typically can start their application in November, which is the fall, and that application has to be turned in by April. So this past April 1st is when our students who are applying to the Hyder program or Hyder Early Assurance Program for fall of 2021 applied. If you are admitted to this program, it is binding. So students that are accepted, they do have to attend the program. One of the unique factors about this program that students seem to be interested in is that the MCAT is not required. So for the general Hyder program, as well as medical school across the country, when students apply, an MCAT is required. But for this program, the EAP program, it is not. So that tends to turn students on and seemingly very interested in the program. If students have taken the MCAT or do plan to take the MCAT, then their MCAT score will have to be submitted. Like the Hyder program, there is no fee to apply. This program, again, is for students that are planning on, that are attending UCR and are planning on earning a bachelor's degree from UCR. And that's typically what makes it, I think, of interest. It is very competitive, but less competitive across the board in terms of applying to maybe other medical schools, because UCR students can only apply to the Hyder program and the Hyder EAP program. So medical school is competitive across the board, but this tends to be for students that do want to stay in underserved areas, those who are in tune or do understand the School of Medicine's mission statement and want to be continuing their education here in the Inland Empire. There is a GPA requirement for this program. So in order for students to apply to EAP, students have to earn at least a 3.4 GPA or better, and that's in their sciences. So that BCPM that you see stands for biology, chemistry, physics, and math. There's a lot more that you can find out about the Early Assurance Program. If you go on to UCR School of Medicine website, there's a page that's dedicated to the Thomas Hyder Early Assurance Program, as well as the Thomas Hyder Early Assurance, the Thomas Hyder Regular Program, and the Early Assurance Program. So setting a foundation is really important as you're planning to go to college, and also thinking about the health professions. Finishing up high school is really important. I know we're in April and many schools are winding up next month or very early June. So we're just encouraging students to stay strong, especially given that you're probably you're taking classes remotely and your interactions are remote, to just still stay steadfast in working really hard to earn the grades that you want to have in preparing for college. That also sets the tone for once you do get into college. Additionally, we've always encouraged students to try to shadow health professionals. I realize that at this point that's really challenging due to the current state of the world, but generally speaking, it's really helpful to do some shadowing and do some, Q&A, or going to coffee, or just talking with someone that you might be interested in pursuing that career. That's also helpful to help you figure out where you want to go to college, and get started off on the right foot. Getting involved in student organizations, pursuing leadership roles. So at UCR, we have roughly 40 pre-health student orgs. You'll find out if you do decide to come to UCR that we have about 300 student organizations, but of those 300, roughly 40 or so are specific to the health professions and serving the community in some type of health-related area. I would also encourage students to pay attention to what's going on in the news. Obviously, that's very apropos for now with COVID-19 and infectious disease as a whole. But it's often just really understanding what's going on in the world to know if you want to be in it. Again, not to belabor what's going on, but I'm sure we all see every day on the news our health professionals being on the front lines. And that's what this career is about. So if you are somebody who doesn't like to be on the front line when severe health issues are are being faced in the community or globally, this might not be something that's right for you. So continue to kind of follow what's going on in the news and just various issues and how we're solving these problems. And then when you do that, reflecting on your experiences academically and co-curricularly. I say that because we talk with students that come in that are willing to spend as much time and money as they can on pursuing a career in the health professions. And then we have students that come in as well that say, I really want to pursue a career in the health professions. I also want to finish school after 4 years, and I don't know that I want to advance my education. I also want a 9-to-5 job, want nights and weekends free, and sometimes we can work around that. There are a lot of health professions that aren't on 24 hours, 7 days a week. So if you're interested in being a trauma physician, orthopedic surgeon, anesthesiologist, those are your 24/7 jobs. So nights and weekends, 40-hour work weeks aren't necessarily going to happen, at least very early on. But we do have students that come in and they say what they want, and we will talk to them about careers that they may not know a lot about. Maybe it's optometry, maybe it's occupational therapy, maybe it's genetic counseling. So that's why it's important to reflect on your experiences and know, what's the pros for you, what's the things that you don't want. And if you haven't had those experiences, then we really are going to encourage you to get out and start taking advantage of what's out there and getting an idea, a sense of where you might want to move forward. So some resources to do that. You all have access to the web, about YouTube. There's lots of things that you can Google, but a really great resource that we use in our office and a lot of health professions programs like HPAC use are explorehealthcareers.org. This is a free resource that will allow you to explore those 120 health professions or more. A lot of great information there in terms of defining what health professions jobs are, what those folks do, how to be trained, or what's the proper education pathway. There's career information in terms of need, which in the health professions, there's always going to be a great need. And then they'll also talk about some job, labor, pay statistics as well. So explorehealthcareers.org is a great resource. Another resource is inspiringdocs.org. That's really helpful. It's put together by the Association of American Medical Colleges. So they're great resources for high school students, college students, parents of high school and college students. And again, that's a free resource as well. Our office, I've mentioned HPAC, hpac.ucr.edu. We have a lot of information on our website. And then for our students that have time to, that extra time to read, below are a couple of resources that you might want to take advantage. These are books that I've read, that colleagues have read, that are written by either practitioners or people who have had an inspiring story regarding healthcare, taking care of people, and health in general. So just a couple of resources there specific that you might want to check out if you haven't already. We are located in Rivera Library. So I mentioned that very early on. That is our physical structure for this quarter and perhaps even summer. We are not sure exactly. We are going to be working virtually. So you'll see our contact information there. You're welcome to email our office if you have additional questions. For academic advising, we do reserve that for students that are current students and students that are about to graduate or alumni. But if you do have questions, something that maybe I wasn't clear that we're not able to answer today, you'll see our web address there. You can hop onto our website, you can email us, you can follow us on social media, Facebook, Twitter, and Instagram. And we are happy to try to answer your questions or get you pointed in the right direction. So with that, we're going to go ahead and start taking questions. We have just a little bit shy of a half an hour left to start answering your questions that you have. So we're going to go ahead and do that now.
Thank you, Charlie. Answered about 50 or so questions as you were presenting. We have a fairly large group and lots of questions. Okay. So we're still gonna get to answering a lot of the questions that are remaining, but I wanted to just touch on a couple common themes that we've been seeing. So the UCR Health Professions Advising Center, that's what HPAC stands for, Health Professions Advising Center. We are an advising center. We're not a club or a major or a program or a certificate. So we don't require any type of application. We work with all students in all majors pursuing all health professions. Students can be in any major and pursue most careers in the health profession. So for those students wanting to pursue medicine, dentistry, pharmacy, something at the doctorate level, you don't have to major in a specific undergraduate discipline. It's more about taking the required prerequisite coursework, which I'll pull up our prereq handout here in just a second. The most common health profession that does require a very specific major is nursing. Nursing is not an undergraduate degree that's offered at UCR, but for students who are interested in going into medicine, there isn't a specific undergraduate major that's required. You'll just need to take the required prerequisite coursework regardless of what your major is, as well as have a strong GPA. The average GPA for students accepted to medical schools across the country is a 3.67, as well as take the MCAT, extracurricular experiences, letters, so on and so forth. But for students attending this session, your major is not a strong factor that's taken into consideration. It's the prerequisite coursework that you've taken and your GPA. The Health Professions Advising Center does not house a specific student organization. So there's over 500 clubs and organizations at UCR, and many of the students that Charlie and I work with are members of those student organizations, but we do not have a student organization ourselves. We also do not offer any clinical experiences through HPAC, but as an advising center, we regularly talk to students about how to go to other hospitals, clinics, doctors' offices, dental offices, optometry offices, and gain clinical experiences. But students will need to formally leave, not leave the university, but step off of the university premises in order to gain clinical experiences. I actually got quite a few questions about the campus veterinarian. UCR does not have a doctorate school in vet med, so it's called a DVM, a Doctorate of Veterinary Medicine. There are 21 schools that offer a DVM. UC Davis is one of them, and UC Davis does have a very strong animal science undergraduate program. The campus veterinary website that you all have found, that is the veterinarian that works for our science college, taking care of the animals that are being used in research experiments. So many faculty on campus are using mice and rats and chickens and other animals in experiments, and that's what that campus veterinarian is taking care of. We also don't have a PA program. The only health professions program that UCR offers is medicine. That doesn't mean that we don't serve pre-dental students, pre-pharmacy students, physical therapy students. It just means that the only professional school that the campus has is medicine. As Charlie mentioned, the UCR School of Medicine does reserve 24 seats for UCR students and UCR current students and UCR alumni into their medical school. This is 24 seats maximum. No additional students will be accepted, which is why Charlie and I do so much advising for students to be applying to other medical schools or dental schools or pharmacy schools. Obviously, if we're serving 5,000 students, not all of our students are going to be matriculating to the UCR School of Medicine. So again, there's 24 seats in the UCR School of Medicine that are reserved for UCR students and UCR alumni. Some of those seats are for the early assurance program, and some of those seats are for Hyder or for the regular admission cycle. We can't tell you from one year to another how many are going to apply or be accepted to EAP versus Hyder. The only thing we can say is that 24 UCR students and UCR alumni will be accepted into the UCR School of Medicine each year via EAP and Hyder put together. And generally speaking, the same level of competitiveness that a student would need to get into any MD school is going to be the same level of competitiveness that a student would need to achieve to get into the UCR School of Medicine via either of their routes, EAP or Hyder. We do work very closely with the UCR School of Medicine, but we are not organizationally housed within the UCR School of Medicine. So for those of you asking about the Fast Start program, you're going to have to refer those questions directly to the Fast Start coordinator. And I think I've sent most of you their website. But that question, along with questions from your major or study abroad, I've gotten a lot of questions about things that Charlie and I can't answer. So when you need to take your math placement test, when you need to take your English placement test, whether or not you can study abroad, those are things that you'll have to address directly with admissions or your major advisor or the study abroad office.
All great questions.
Those were a lot of the common themes and trends that I saw. So I'll pause there and get back to reading the questions. Perhaps Charlie may have seen some questions that he wants to address.
Yeah, I have a couple. Thanks, Amber. So I have a question regarding study abroad. Is that possible for pre-med or pre-health students? The answer is typically yes, if the student plans very early on. Generally speaking, we would want the student to work with their major advisor and our office. But long story short, it's generally not a problem, except we ask for students to avoid taking the science prerequisite courses abroad. So if a student is coming in and they're a biology major, a chemistry major, a major that requires the sciences, or maybe you're even interested in, let's say, a non-science major, but you want to get started with your science classes, it's probably best that you study abroad before you do that, maybe in your first year or second year. or that you try to study abroad in the summer when you may not be taking science classes. Once you get into your third year and fourth year, you're starting the application process. Generally speaking, in your fourth year, that's when students are interviewing at health professions programs. So again, yes, it is possible to study abroad, but you do have to plan in advance. And generally speaking, we're going to encourage you to do that earlier than later, or to try to do it during the summer when you may not be taking classes at all. Another question, how can we get clinical activity hours, internships from UCR in general? While our office doesn't organize those specifically for you, we do send out opportunities that we get through our office. We do have, as I shared earlier, we do have roughly 40 pre-health clubs on campus, and some of those clubs do organize, clinics, community clinics. We have clubs that organize shadowing, physician shadowing. We have clubs that bring in speakers such as physician assistants, pharmacists, physicians, dentists, and sometimes those clubs will work with those practitioners to maybe set up some shadowing. So there's lots of different ways of doing that. Additionally, our ambassadors are often doing these same activities, and so we are encouraging students to meet with them. So even though we are a fairly large university and we have a lot going on, I will tell you that we do have students that are doing a lot of clinical opportunities. A really popular thing is COPE, being a COPE Health Scholar program, which in Riverside is at our Riverside Community, in conjunction with our Riverside Community Hospital and Kaiser Permanente. We also have students doing it in LA and other places when they're at home in the summer as well. But there are a lot of opportunities available. And again, if you go onto our website, we do have some information there about getting involved locally as well as the state, across the country, and globally. And then we also have a workshop, I believe that's video recorded by some of our ambassadors we put up a couple of years ago of ideas where you can get involved in clinical opportunities. Another question, if we're enrolled in a non-science major, can peer advisors help us fit in our pre-med requirements into our schedule? Absolutely. If you come to our Intro to Health Professions workshop, we can help with that as well. But our peer ambassadors also know that process. In addition to the question that I asked, that I answered, it was asked, is Hyder for non-science majors? The Hyder program is open to anybody, science or non-science majors that have completed the prerequisites for medical school.
Okay. I'm getting a lot of questions about students wanting to schedule advising prior to matriculation. So Charlie and I do intro workshops every quarter, fall, winter, spring, as well as in the summer, that give a lot of basic information to students about program prerequisites, GPA requirements, gaining clinical experiences. So students can come to that whenever they need to. So they're welcome to attend those sessions during the summer. At your freshman orientation, you'll meet with your major advisor who will help you enroll in fall quarter classes based on what you've placed into for math and English, if you have any AP credit or not, and then what are your major requirements. So you won't necessarily meet with Charlie and I as pre-health advisors. We're more of a secondary advising resource, but you will meet with your major advisor during freshman orientation, and they will assist with your enrollment based on those things that I mentioned, your placement test, your AP credit. Those are things that Charlie and I have access to. If you're in a science major, you can rest assured that your enrollment for fall quarter will be in line with doctorate level health professions, med, dent, pharm, vet med, podiatry, physical therapy. So if you're a science major, you'll be taking those science coursework fall quarter, and your major advisor will assist with that.
Great questions. We have some additional questions regarding the EAP program, so the Early Assurance, Thomas Hyder Early Assurance Program, as well as the Thomas Hyder Program. You can get more information if you log on to the UCR School of Medicine website, medschool.ucr.edu. So if you go onto their website, you will see under admissions, it lays out the Thomas Hyder program and the EAP program, and it will talk about all the specific information and criteria that they're looking for in their future applicants. Let's see here. We also have a question about shadowing. Can I shadow physicians at UCR School of Medicine, or how do I go about shadowing physicians and other health providers in the community? So this would be something that you would have to reach out to the provider. We typically encourage students to contact the provider directly or to contact the clinic. We in our office do not set up shadowing. Hospitals typically at large don't set up shadowing. So this is something that would be between you and the provider. And this is also the same for other health professions programs such as PA, dentistry, pharmacy, that type of thing. If you are interested in doing shadowing, reach out to them. If somebody tells you no, that that's not their practice or they're not able to, you could also maybe ask them for coffee or, you know, a 20-minute interview, phone interview on some questions that maybe you've written out to help find out more about their profession. So shadowing is not the only way to have this communication and to get the information, but it's definitely, if possible, it's a great opportunity to have insight into the field. Let's see here.
So for those students who are interested in a career other than medicine, I know we've been spending a lot of time talking about the UCR School of Medicine, the Early Assurance Program, Hyder, but that certainly doesn't represent our total population of attendees here today. So Charlie and I do advise for most all health professions. As he mentioned early in the presentation, there are 120 different health careers. And let me screen share here.
Are you pulling up the prerequisite sheet?
I was going to pull up Explore Health Careers. Here we go.
Okay.
Okay, so I think everybody can see this. So this is a really awesome database that we're on pretty much every day, explorehealthcareers.org. This is going to be a full picture for you all to see that you know, there is medicine, MD, DO, PA, nursing, dentistry, pharmacy. Those are the 4 careers that we all kind of hear pretty often, we interact with fairly often. But I've had students asking me about physical therapy, occupational therapy, veterinary medicine, public health, even mental health counseling, like being a therapist. So there are 120 different health careers, and Charlie and I are here to assist students in first and foremost identifying what health career is going to be the right fit for them, and then setting up a plan for them to pursue that profession. Most, if not all of the students that we work with, when they go on to their graduate and professional program, will be leaving UCR. So of these 120 different health careers, the only one that's offered at UCR is medicine, a graduate degree in allopathic medicine and MD. That's the professional program at UCR. But many of our students want to do dentistry, pharmacy, physical therapy, or optometry, and all of those doctorate level programs would be at different institutions that after the student completes their undergraduate degree at UCR, they then would apply to a graduate level program at a different institution. That is what Charlie and I are experts in, is helping students navigate that process. We can definitely answer as many questions as we possibly can about the School of Medicine, but that's actually not all of you that are on this presentation today. And if you do find that you have a lot of really specific questions about the UCR School of Medicine and the Early Assurance Program or the Hyder program that perhaps we weren't able to answer today, you're able to contact that school directly, similar to how I was sending the Fast Start page to a lot of you. There's contact information here. There's also going to be contact information for the UCR School of Medicine. Oops, I spelled that wrong. Although we're going to do our best to answer all of those questions as well. So they have their website and their contact information down here at the bottom as well.
And in addition to what Amber's sharing, I just want to remind you that we are recording this session. So some of the specifics that I covered earlier will be posted. The workshop will be posted on the Office of Admission event schedule website, probably by either at the end of this week or next week. So you're able to go back in to watch that as well as in case you have additional questions.
Another common question that I'm seeing is asking about the similarities and differences between an MD physician and a DO or osteopathic physician. I don't know that I have enough time to fully explain all of the similarities and differences between those two professions, but they both are physicians, so both MDs and DOs, as well as podiatrists in some cases are considered physicians. They diagnose and treat patients, they write prescriptions, they perform procedures, they create care plans, they educate patients. It's just that their schooling is a little bit different. The philosophy of the professions are a little bit different. And osteopaths learn an additional technique called osteopathic manipulative medicine, which is some spinal and structural adjustments to help relieve pain and alleviate pain. Realistically, the two professions are much more similar than they are different. And oftentimes when students are applying to medical school, they're applying to both MD programs and DO programs at the same time. The prerequisites and competitive admission standards are the same between the two professions. They require the same prerequisites, the same exam, similar extracurricular activities. The applications and application timelines completely mirror each other. So when we speak with the student about medicine, generally we're lumping MD and DO together, both as physicians.
I have another question regarding finishing studies along with being pre-med in less than 4 years. Is that possible? So it really depends on if you're coming in with AP work or if you're coming in with post-secondary or dual enrollment. It is very challenging to be able to take these science courses as well as your electives, as well as participate in shadowing, volunteering, maybe research, as well as preparing for the MCAT, or if you're interested in dental school, the DAT. So we come in, when students come in and they want to discuss a timeline, the general timeline from coming in right after high school all the way up through graduation is 4 years. If a student wants to lessen that, then we can help them pencil out a plan what that might look like. But we encourage students to always be thoughtful and to gauge quarter by quarter. So we are on quarters, not semesters. We have 3 quarters during the year that are 10 weeks each quarter. And our students often find that that is very challenging for them once they're in and they're doing lecture and lab and they're going to student org events. Again, volunteering, shadowing, and we have not even added in a part-time job if that's even happening. So we do encourage students that this really probably in their best interest is 4 years. If along the way you shorten that up, that could be great for you. But going into it, I wouldn't recommend making this less than 4 years for our students coming from high school to college.
I'm also seeing a lot of questions about freshman orientation. Um, that might be questions that you all need to refer to the orientation office. I believe that freshman orientation is going to be online solely over the summer, potentially due to COVID, or potentially it was already online before that happened. So for your freshman orientation schedule, you'll want to contact orientation.ucr.edu.
See a question regarding undergraduate research and how students can participate in that. So we have a research portal at UCR for students. Once they've started matriculated to UCR in the fall, you can access the undergraduate research portal. And that's where faculty across all disciplines, all colleges will put in research opportunities. So that would be wet lab science, research science, that could be business, that could be humanities and social sciences. There are opportunities there for freshmen through seniors. You can log into there and it will tell you what the research opportunity is, how much time, if there's any prerequisite courses that are needed before participating in research, if there's a GPA that's required, if it's for credit or non-credit, if it's for pay or non-paid position. So again, the undergraduate research portal. Seeing questions about, go ahead, Amber.
Sorry, I just want to, because I know we're kind of running out of time here. Charlie and I can provide admissions statistics for UCR students applying to MD programs across the country. And many students I've shared that with, and I guess I can do that briefly here if people are still listening. But we can't provide acceptance data specifically just to the UCR School of Medicine. 24 students will be accepted to the UCR School of Medicine each year. So 24 UCR students and UCR alumni are accepted. We track and report data for medical schools as a whole. And DO programs as a whole. So for 2019, so for this past application cycle, UCR students were accepted to MD programs at a 26% rate and to DO programs at a 42% rate. But we can't give you a percentile breakdown for the UCR School of Medicine specifically, but I can tell you that 24 of those students that applied to medical school matriculated to the UCR School of Medicine. That's a capped number. I hope that makes sense.
See how many classes are required or needed per quarter. That really depends on the major. If you've had AP credit, if you're coming in with any dual enrollment credit, our students are typically taking anywhere between 15 to 16 units a quarter. So it's 15 units a quarter to graduate on time. It's 180 units for most academic degrees at UCR. So generally speaking, students are taking anywhere from 14 to 16. It depends again, if you're taking summer school, if you've come in with AP credit or IB credit or dual enrollment, that type of thing. We do encourage you to be full-time throughout your undergraduate career. And secondly, regarding science courses, we've talked a little bit about grades and MCAT score and that type of thing. But as health professions programs review your application, if you do end up applying, they're going to be looking at each quarter and the courses that you've taken each quarter to make sure that you've taken more than one or two science courses a quarter. Sometimes students come in and they may only want to take one science course. And we tell them that, you know, it's important that you are showing to schools that when you get into medical school or pharmacy school or dental school and you're taking those 5 lectures and labs per quarter or what's equivalent to that, that you're going to be successful. And again, you'll work with your major advisor and your HPAC advisor to determine what schedule is right for you.